Hey, hello friends. Yeah, this is Dr. Priyanka. Welcome in the channel of the House of Health. Today we are going to listen about the homeopathic remedy, the very indicated remedy which is in the OPD of every homeopath, and I'll talk about some important characteristic or the important points which we should apply while doing the case taking or while prescribing the remedy or while taking the follow-ups and relapse of the cases. So yes, the choice of remedy today is tuberculinum, so kindly stay tuned. So tuberculinum is a nucleoprotein, a nosode from tubercular abscess. As a homeopath, everybody knows the source. So most of the time, what are the important indications of tuberculinum we'll talk about. I'll not go into the details about the remedy. You can read about it into any Mater Medica. So the first characteristic symptoms of tuberculinum is hunger. So these people or these patients are emaciated, but even emaciation they have, they are well-being and so hungry and must get up at night to eat. This could be the characteristic symptom. Second is the person with a history of tuberculosis in his family. Third is symptoms ever changing, begin suddenly and ceasing suddenly. So tuberculinum practically needs more frequent repetition in children's complaints than nearly every other chronic remedy. So mostly you can prescribe 30 and above in infrequent doses. When tuberculinum fails, syphilinum often follows advantageously, producing a reaction. Also about talking about tuberculinum, guys, I'll tell you about that tuberculinum is actually told in the keynotes of leading remedies, that is in HCLN, that symptoms are changing, elements affecting one organ then another, that is the lungs, brain, kidneys, liver, stomach and nervous system. That is, as I said, that begins suddenly and ceases suddenly. So tuberculinum bovinum is one of our main constitutional or anti-miasmatic homeopathic remedies, especially for children, those with weak constitution who suffer from frequent infections and allergies, and as well as children with a wide range of developmental and behavioral disorders. So in every case we have to look for the predominant miasm, fundamental miasm and the non-repertorial totality, and that should depict the tubercular miasm, and the simillimum should be prescribed. So tuberculinum as a nosode is mostly utilized as an intercurrent remedy, but for that I'll give you one example why it is intercurrent remedy and why it is called as intercurrent remedy. Intercurrent remedy is the one which is given along with the simillimum when we have to enhance the action of the constitutional remedy. We give the intercurrent remedy when the case comes to cease or when the improvement comes to cease. So once there was a case of retired menstruation in a young girl who had greatly enlarged tonsils and who began to grow tired and weak, pale and short breath on any exercise. The menses appear twice under the action of pulsatilla, but at intervals of several months, and finally not at all. So after the failure of several other remedies to give her benefit, one dose of tuberculinum 1 mg was prescribed with prompt and easy natural appearance of the menses and corresponding improvement in other respects, and is now attending a school in apparent good health. So this was one of the example, guys. That is not mandatory like in everything. Pulsatilla will be followed by tuberculinum, but we have to take the proper case taking, and the important thing to remember over here is the relationship of the remedy. So looking the relationship of tuberculinum, this remedy actually complement soranum and hydrastasis. And remedies which follows well are Calcarea fos, Calcarea, Cilicia and Baryta carp. So yes guys, we have listened and learned about the tuberculinum today. Thank you for staying tuned. If you want such type of study, kindly give the comments, and if you have not subscribed to the channel, kindly subscribe and spread homeopathy, love homeopathy and practice homeopathy. Thank you. Think healthy, eat healthy and love each other. Bye bye.